Good afternoon, everyone. It's Dr. Robin Ledyard, Chief Medical Officer, and I'm here with Dr. Yeleti, the Chief Physician Executive. We're here before you today to talk about the Delta variant. As you can see, we're both wearing masks, and we'll talk some about that. I want you to know, though, that I'm very concerned because our hospitalizations for COVID patients have doubled in the last month. Our caregivers off with COVID have doubled in the last month. I'm going to have Dr. Yeleti talk some about the pathophysiology of the Delta variant, and then we'll talk about the ask that we have for you to keep each other safe.
Hi there. Again, I'm Dr. Yeleti, Chief Physician Executive here. And to follow up on what Dr. Ledyard has said, the reason we want to talk today is that it seemed like things were settling down over the past few months, and they really have been. But in the past about 60 days or so, this variant called the Delta variant has truly taken over the United States, Indiana, and specifically central Indiana. And what does that mean? Well, the Delta variant is several times more infectious than the previous variants. And so that's the difference today compared to a few months ago. So that if you walk into a room and the patient and the individual has the variant, you're much more likely just being in the same room to get the coronavirus and get infected. That's what's being different today than before. What we've seen in studies is that if you look at the amount of virus in the nose, with the Delta variant, there's 1,000 times more of the virus in the nose of an individual that has the Delta variant compared to the original virus. So it just shows us it's highly contagious. And that's the reason again, we're wearing masks. Previously, we thought masks were effective, and they continue to be okay. But with the variant, we have to take every single precaution. And I'll probably also add is that the vaccination provides a much greater level of protection than just a mask. So we do encourage people to stay vaccinated because while masks are effective, they're not at the level of protection as the vaccination itself.
So the ask is it's really twofold. Please, if you haven't, consider getting the vaccine. We understand the exemptions. Your exemption may be already improved. Just look at the information. Talk to people. Please consider the vaccine if you have been hesitant or if your faith should lead you to getting the vaccine. We hope that you consider it. Secondly, we are asking that everyone continue to be masked indoors at all times. And that will be us holding each other accountable, working with patients, families, visitors. We have to stay safe. We don't want more people getting sick with COVID-19. When you are eating at this point in time, we are going to be asking you to socially distance while you're eating just to keep each other safe. We really think that that's the best course of action at this point of time. Again, throughout all of this, we have come to you with the latest information as soon as we look at it and we study it and we digest it and we pivot. And it is all to keep you safe. So thanks for your time and attention today.
And again, a final couple comments related to what Dr. Ledyard said again is that what's different now, we have a very highly contagious variant that we've never seen before. So whether you're vaccinated or not vaccinated, this story is different today than it was a couple months ago. So I know we're all getting pretty fatigued with this, and we just need to keep our guard up a little bit because of what's happening. So whether you're vaccinated or not, use masks, social distance, and do the best we can to get through this next phase of the pandemic. Thank you very much for all that you're doing. It's very, very much appreciated by all of us and certainly all the community around us as well.